Today, we're doing some facial contouring work and making a lip bigger than I would normally make it. Hi guys, welcome to my channel. My name's Dr Sarah Tonks. I'm a cosmetic physician here in London. If you've been watching my channel for a while and haven't subscribed yet, why not? Every time somebody doesn't subscribe, my videographer gets fired. And he's got a family to feed. Doesn't really. Today we're going to be doing some facial contouring work for a young lady, and also I'm going to do something that I don't often do, which is really plump up those lips. For whatever reason, the vast majority of my patients come in and they are absolutely adamant that either they don't want to have lip filler done or they want to have it done, but like so that it's barely undetectable. It's very rare that I get somebody who's game for a little bit more, but on this occasion with the patient that I've got today, she was definitely up for it. So I thought, yeah, why not? Let's do it. Let's give her those full lips that she's after. So let's go on over to take a look at our lady of the day. So it's quite tricky when somebody who comes in who's already attractive, because you have to be very precise with the way that you're doing the injections to make sure that you're upgrading them and not downgrading them. I'm sure by now, if you've been watching my channel for some time, you can pretty much guess what I'm about to suggest. The first thing that jumps out at me here is where the light reflection is for the cheek. So you can see that the fullest part of the cheek is kind of low. It's kind of in this area down here, and we've got light reflection right here. Ideally, what we would see is a repositioning of the lowest part of the cheek to be a wee bit higher, more like here, and we want to take the light reflection that way too. As you probably know by now, the way that that's done is, let's just draw her up. So you draw a line from the top part of this part of the nose to the tragus of the ear, which is that bit there, and then from the lateral canthus of the eye down to the corner of the mouth, like so, and then that would be the area of the light reflex right here. And when we're figuring out exactly where the highest point should be, we take the distance in between the eyes and then use the phi of that, which it will end up being around this point here. So we're going to transpose the cheek upward slightly. The next thing I'm going to do, which again, if you've been watching the channel for a while, you'll know is one of my favorite things to do, is the base of the nose. So in doing this, we're going to improve this nose to mouth line and just this overall contour right there. Lift up the nose and pick it forward slightly. Sounds like that would be a bad thing, right? But actually it looks good when it's done. Again, we're going to do the chin crease. So can you see that there's a bit of darkness across that part of the chin and just a little bit of asymmetry? So you can see if I drop this line straight down like that, there's a bit, so much for a straight line there, but you get the idea. There's a bit of a cant in the chin over to this direction. Would be cool if we could kind of equalize that slightly. She's already had lip filler done, but not for some time, and I took out the little bit that was in there because it was just a little bit too full in the central portion. This patient really likes to have a full look to the lip, which is what we gave her. So I used a few different techniques in order to get the result for her. And we also did the angle of the jaw. So let's go over and see exactly how it was done. First things first, bit of toxin, frown lines, forehead, DAO, and the mentalis. The purpose behind this is just to give an overall relaxed and refreshed appearance to the face. Second thing, we're going to do some filler at the base of the nose right here. As I mentioned to you, this is one of my favorite places to inject because it's one of those places that you can fill and literally nobody knows that you've done that, because there's very little awareness that this is a thing, that filling the base of your nose is a thing. Well guys, it's definitely a thing. Now we're going to do the angle of the jaw. I'm not putting much in here. I'm literally just sharpening up that angle very slightly for her. And then we're going to go and use a cannula in the chin crease. This is where it gets exciting, or exciting for me anyway, because I'm kind of a bit geeky about this sort of stuff. I'm going to mark up the cheeks like I just showed you on the iPad, looking for that point of light reflection and the highest point of the cheek. So here you can see I'm doing the right cheek with a needle. So this is kind of interesting. When you do a cheek injection, there's lots of different ways that you can like manipulate the tissue when you're putting the injection in. So you can either lift up the skin and inject straight down. Some people literally just inject straight down. Other people tense up the skin like this into a tent and then inject straight down. The technique that I'm doing here is more for lifting. So I'm going deep, injecting straight down and then lifting the skin a little bit further and injecting a wee bit more. I think it's small touches like this that will take a result from being good to being really, really good. So for example, facial massage after you've had an injection. It used to be thought that facial massage was unnecessary, you didn't need to do it, you were in danger of flattening your filler out. And that's true if you do it in the wrong way or if you do it too hard. But for example, when doing the cheek injections here, I'll now increasingly get the patient to massage the face upwards like this because it helps with tissue integration and it will help to give a smoother and much more better contoured result. So after an appointment, whenever I've done filler, I'll show the patient how to massage the area and what pressure to put on there as well. So over to the lip, which is her main event, I guess. We're going to use a cannula, first of all, to give some base to the lip. And there is a previous video that I've done about needle versus cannula and what one will do versus the other. Cannula tends to make the lip a little bit wider in this direction, whereas if you use a needle, often you're using it more for projection or for turning the lip upwards. Obviously, you can be a lot more accurate with a needle than you can be with a cannula. Cannula is more for a field effect. Then we're going to use a needle from the philtrum, which is outside the lip, to the medial tubercle, which is that bobble right in the central portion of the lip there. Let me draw it for you. The medial tubercle is this bit right here. Actually, while we're on the subject, you've got two tubercles in the lower lip, which tends to be in line with the nostril. There's one there and one right there. So the fullest part of the lip should form this triangle, like so. And for those of you who keep hearing me talking about the Glauco-Klein point and not sure where it is, it's this bit here, since we're doing a close-up. Now I'm going to use a small 32 gauge needle to the vermilion border of the upper and lower lip. This helps to rotate the lip up and round. And lastly, we're going to finish off by doing this Glauco-Klein point with the 32 gauge needle. Check out those cheeks. So you see the contour of the cheek has been lifted up a wee bit in that direction. So the highest point of the cheek is now up here as opposed to being down here. We've also got an improvement in the chin. So you can see that the lower facial third is a little bit longer than it was previously. And that's because we've rotated the chin downwards by injecting across the crease. And this is kind of interesting. Let's just have a look at the angle of the jaw here. So can you see this distance between the top part of the cheekbone there and where the angle of the jaw starts? And compare that with this side. So that distance is just very slightly smaller. And it looks like the face has been lifted upwards. And of course, this is a thing that you all wanted to see, right? The lip. Well, the lip structure itself looks pretty similar in the before and afters, but what we have at least managed to create is a bit more fullness in the middle part of the upper lip. So recreating that medial tubercle, which is an anatomical thing to have. I probably wouldn't go any bigger than this. As you know, I'm not one for overly augmenting the lip. I much prefer to do a more subtle result. But I think on her, it actually looks quite cute. And let's take a look at a picture of her smiling. Come on, guys. She does look cute, right? On this picture, you can see that the fullest part of the cheek has been raised up very slightly to this point here, as opposed to being a wee bit lower there. The lip looks pretty good on smiling, maybe just slightly fuller in the upper lip, and you can also see that she's got less muscle pull here. So you see on the before where she's smiling, there's a bit of a pull downwards and a slight cant to the lip, whereas here we don't have quite as much pull there because we filled the chin. So it means that the lip doesn't come down quite as much as it did beforehand. Okay guys, so that's it for today. I hope you enjoyed the video. If you've got any comments that you'd like to make, if you've maybe had lip fillers yourself before or you're thinking about having them done, let me know in the comment section below. Don't forget to come back next week where we're talking about more things to do with injectables. I will see you then.